In this topic, I'm going to discuss about neonatal physical examination or newborn examination. To start from vital signs and anthropometry, there are a lot of variables. From this, heart rate, respiratory rate, body temperature, length, head circumference, and the weight are the most important ones. The normal heart rate in newborn is from 120 to 160. Respiratory rate is from 30 to 60. Temperature from axillary is from 36.5 to 37.5. The length of newborn is in average from 48 to 53 centimeter. Head circumference is from 32 to 38 centimeter, and the body weight is 2.5 to 3.99 kg, which is called normal body weight, or the body weight that a term baby is expected to have. The next is head and the neck examination. We should have to examine the fontanelles, the size and the tension, and also sutures. And we should have to check the presence of caput succedanum, which is due to scalp edema that crosses the midline. We should have to also check for cephalohematoma and subgaleal hemorrhage. Cephalohematoma does not cross the midline and it's caused by subperiosteal bleeding, whereas subgaleal hemorrhage is a bleeding in the potential space between the scalp periosteum and the scalp galeal aponeurosis. This crosses the midline and it causes extensive bleeding. The next is examination of the face, nose, eyes, and the ears. We should have to check for the presence of cleft lip and the cleft palate, hierarchic palate, any dysmorphic facial features, shape of the nose, nasal flaring, and the choanal atresia. To discuss them specifically, we should have to examine the shape of the nose. The newborn baby's nose often appears compressed, particularly if there has been reduced amniotic fluid. This will correct spontaneously in few days. Nasal flaring is when the nostrils widen as the baby breathes. This is a sign of respiratory distress and needs urgent assessment. Choanal atresia should be suspected when there is respiratory difficulty, which is relieved by crying. As during crying, babies breathe through their mouth rather than their nostril. And the respiratory distress worsens when the baby breastfeeds. So, a respiratory difficulty which is relieved by crying and worsened by breastfeeding is high likely choanal atresia. In choanal atresia, the nasal airway is narrowed or blocked by a bony or membranous septum across the posterior nasopharynx, and in most cases, or two-thirds, are unilateral. When choanal atresia is bilateral, it is an emergency, and the infant rapidly becomes cyanosed. The emergency test for choanal atresia is try to pass a number 6 catheter 3 cm down to the nostril. If we can't, it is choanal atresia. The other is about examination of the eye. We should have to check for the presence of ptosis, large eye discharge, and red reflex. Large eye is indicative of congenital glaucoma and is usually associated with corneal edema. Red reflex should be elicited for both eyes to exclude the presence of congenital cataract. An absent red reflex is a sign of congenital cataract, while a white red reflex could indicate retinoblastoma. The other is examination of the ears. Check for low-set ears. Ears are considered to be low-set when the root of the helix is on the level below a horizontal line drawn from the corner of the orbit. Check also pre-auricular skin lesion. Lesion on the face anterior to the ear. They may be fleshy papules or tags or superficial dimples. Some consist of skin only, others contain some cartilage. They are encountered in 1% of babies, and the renal ultrasonographic examination is not recommended unless there are other anomalies. Macrotia is a disorder where the external ear is underdeveloped. The macrotia ear is smaller in size, and the external auditory canal is absent in most cases. Macrotia is encountered in a number of syndromes such as Tricher, Collins, and a hearing deficit will be present if there is macrotia. The other is about examination of neck. Observe the appearance of the neck, whether the neck is short or not, whether there is redundant skin in the neck, and also presence of mass and range of movement. If there is congenital neck mass, try to classify as preauricular, postauricular, midline, and lateral neck, because each have their own differentials. For example, preauricular mass is due to lymphatic malformation or hemangioma, whereas postauricular is due to fist brachial cleft anomalies, and midline can be due to thyroglossal duct cyst, ectopic thyroid, dermoid cyst, lymphovascular malformation. Lateral neck, congenital neck mass might be due to brachial cleft anomaly, lymphovascular malformation, thymic cyst, sternocleidomastoid tumor infancy, laryngosale. The other is about chest. Enlargement of breast might be a normal finding due to hormonal withdrawing, and the chest of the newborn normally is barrel-shaped and smooth at birth and expands symmetrically. Occasionally, irregularities in respiratory rate with apnea up to 10 seconds can be normal. This is breathing pattern of newborn. It's not apnea. If it is irregularity of breathing, of cessation of breathing up to 10 seconds without any color change. When we came to heart and the blood vessel, maximal cardiac impulse is felt in the left fourth intercostal space. Murmurs are present in large number of normal newborn, but the lack of murmur does not eliminate the diagnosis of congenital heart disease. When we came to the abdomen, the liver's edge usually is felt 1 to 2 cm below the costal margin in the neonates, and the umbilical cord contains two arteries, which are small and thick walled, and one vein, which is larger and thin walled. Umbilical hernia is a common finding in newborn, and we should have to also check for abdominal wall defect, such as omphalocele and gastroschisis. Omphalocele is abdominal visceral netting into the base of umbilicus, which is covered by membrane, and most of the time omphalocele is syndromic, and gastroschisis is intestine outside the body through the abdominal wall defect without any membrane covering, and most of the time gastroschisis is not syndromic. When we came to genitalia, the baby should urinate within 24 hours. Testes normally are in the scrotum of term infantis, and the newborn penis is greater than 2 cm length. A mucoid vaginal discharge is present in nearly all mature female infantis due to hormone withdrawal. Mild scrotal hydrocele is common normal finding in newborn male babies. We should have to also check for anal area and the anal patency. Normal newborn should defecate within 24 hours. Also check for the skin of the newborn. The skin might be covered by a white, greasy, easily removable material called vernix caseosa. Mongolian spots over the back are a normal finding, and there are also other benign neonatal skin problems such as pustular melanosis, milia, erythema toxicum, and others. When we came to the neurologic examination of newborn, check whether the baby is alert or not, and also check for neonatal reflex. From the neonatal reflex, Moro reflex is one. Moro reflex is obtained by placing an infant in a semi-upright position. The head is momentarily allowed to fall backward with immediate re-support by examiner's hand. The child will symmetrically abduct and extend the arms, fingers opening, followed by flexion and adduction of the arms, which is an embracement-like action. It can also be produced by loud noise or sudden motion. This Moro reflex appears at birth and disappears at 4 months of age. An asymmetric response or unilateral absence might signify a fractured clavicle, brachial plexus injury, or hemiparesis, whereas a bilateral absent monoreflex shows significant dysfunction of the CNS. Persistence of monoreflex beyond 4 months shows cortical brain damage. There are also other neonatal reflexes that the baby born with to help them survive, such as grasp reflex, crawling reflex, palmar grasp reflex, rooting reflex, suckling reflex, and placing reflex. The last thing that I wanted to talk about is there are a lot of physiological phenomena of the newborn that we should not worry about. Those are physiological weight loss up to 5 to 10% of the body weight during the first 5 to 10 days of life, overriding or molding of the bones of cranial vault, vernix cases, acrocyanosis, physiologic jaundice, benign neonatal skin problems such as lanugo hair, Mongolian spot, milia, erythema toxicum, bluish sclera, mucoid vaginal discharge, which might be tinged with blood, breast engorgement, periodic breathing, and jitterness. Those are physiologic phenomena, so you should not worry about those things. This is all about neonatal evaluation. Thank you for watching.